Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzey. And as always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I have the very great pleasure of welcoming Ann Walsh out of New York. Anne is a certified wound care nurse practitioner. She's an expert witness. She's published on topics of wound care, again, on pain management, in substance abuse and advanced illness. She educates on the difference between palliative care and hospice. And she is an app developer. She has a new app called Wound Care Pro. So welcome, 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 Anne.
Thank you so much for having me. It's great to be
My
here.
pleasure. My pleasure. So first of all, why are you a nurse?
Well, it's interesting. You didn't really know what I wanted when I was going to college, and I ended up in finance, believe it or not. And it worked for about a year in Merrill Lynch. But as I was going to school, I was working in a nursing home, to help pay for my expenses. And I was
Yeah.
working in the kitchen, the dietary department, but was involved with the nurses at the facility. And I respected them so much. And as I was working in, finance world, I didn't find that fulfilling. So I ended up going back to school for nursing. So it's sort of just chance meeting all these nurses out there and having such respect for them.
Yeah. And you know what? You just said something that's very, very telling because you said you didn't find the finance world as fulfilling. And that's the thing that I've noticed. I can dabble in other things sometimes myself, but having been a nurse, it's hard to find something else that gives you that same sense of
Absolutely.
fulfillment. Yeah, yeah. But what challenged you?
Well, when I went back to school and I was first doing my training and I was in the hospital situation, I was kind of like, oh, I hope I like nursing now. I don't want to have another, a degree. But once I got the training in home care, I was like, oh my God, that's my niche. Whereas other students were almost shying away from, oh my God, being in other people's homes and around, the Bronx or wherever we were. And I loved
Yeah.
it. And I was, oh my God, this is me. So I was excited. But it's challenging because you're out in the community, you're on your own, basically. I mean, other colleagues are a phone call
Yeah.
away. But I think not everybody likes that because you're not on a hospital floor where you could say, hey, can you look at this with me? So that was challenging. You really had to be on your own 2 feet and think,
Mhm.
but it forces you to learn so much and, to meet everybody out there where they live. And it's
Yeah. Yeah. It forces you to learn not just about where you are as a nurse, but about you.
exactly, exactly. And it was just, amazing. I remember even having my sister had a child, and she was working. A lot of times she was running late to pick her up, and I'd quickly have to leave the field, pick her up, and bring her with me at times, and have her sit there. And so she even learned. She was about 8 or 9 or whatever. And it's like, oh my God, just like educating her on the community, and I think it was a good experience for her too. But yeah, you go out there, you
Yeah.
never know what you're walking into, basically. So.
I have to tell you that I have the utmost respect for her home care nurses. And you're into two areas that I shy away from. I lasted one day in home care. I thought I would try it after my children. I was like, oh no.
Yeah, I mean, I was younger. Now I'd probably be like, oh my God, like just traveling and parking and traffic and everything else in New York. But no, I loved it, and you know, um, whatever. I guess everyone's got their niche.
Everyone has a niche, and that's the beautiful thing about this profession because there is a niche for every single person. So, yeah.
Absolutely. And then you
Yeah,
see where the patients are at. We're in the hospital, another setting you might not know, and you tell them do this, do that. Then when you meet them at home, you see different challenges they may have, and
exactly.
why they can't follow through with
Right.
what
Hmm.
instructions are given. And
Exactly.
yeah.
Exactly. Exactly. So home care, community sort of work is the only work you did. Did you ever work in an institution?
Not really. I mean, I did training in the hospital, briefly as
Hmm.
part of the nursing school. And sometimes we'll see our patients in assisted living facilities and in nursing homes. Now that I do hospice care, we meet the patient wherever they are. So I go in
Hmm.
for that reason. And I still prefer home care because when our patient's in a nursing home, for example, we have to, tread lightly because we're
Kind of.
sharing the
Hmm.
patient, so to speak. And I
Yeah.
find a lot of, information needed about pain management. They may say that patient's not in pain. I said, the person's in pain. They may not be able to tell you, but they're in pain. Whereas if you're in the
Yeah.
home setting and the family most of the time are on board with you and, we can go ahead and manage.
Yeah.
Whereas the nursing homes, a lot of, oftentimes education. If the person was suffering from pain from rheumatoid arthritis, now they have dementia. That pain didn't go away. They just can't tell you
Didn't.
anything. So just, a struggle, but we're happy to be able to be in there and hopefully help the patient and their
Yeah.
family navigate the
Yeah.
system.
Yeah. Yeah. There's a lot more autonomy in that setting, in the home care setting.
Yes.
What made you so interested in what brought you to wound care specifically?
Well, when I first started in the community, I really realized I had no experience in wound care. So when I would go into patients'
Mhm.
homes, I really didn't know what to do,
Yeah.
so to speak, and do a
Yeah.
good assessment. And I had a mentor that was at the agency, and she was great. She specialized in wound care, and she would make joint visits, or she was always a phone call away for all of us. And she would offer classes for us after work or whatever to get certified if we wanted to ourselves. So
Yeah.
over time, I was like, yeah, I really need this knowledge. If I saw a patient with an ostomy, I wasn't even sure how to order supplies for them or how to measure the stoma. So all these things that she
Yeah.
helped me with, and I had such respect for her and the rest of them in that department, and it prompted me to go back to school and get certified.
Yeah. Yeah. That's huge. Because mentors mean so much.
Oh my God, so much. Yeah, I don't think I would have survived out there without her. And we had a diabetes specialist. And at that time, HIV and AIDS was huge when I was out in the
Hmm.
field. So we had a specialist for that. So we had somebody to reach out for any of these complicated issues. It was great, a cardiac specialist. So we were really lucky back then to have those people to educate us
Yeah.
and give us the tools to help the
Yeah.
patient. Yeah.
Yeah. Yeah. Yeah. Yeah. Yeah. Yeah. Yeah. And so, since we're talking right now about wound care, I'm going to bring right in right now the Wound Care Pro app. So, what made you develop that first of all?
Yeah, so I mean, all these years in wound care, and I still see, like it was for me back in 1995 when I graduated nursing school, that people really aren't getting the wound care education, whether it's
Education.
nurses or the physicians that rotate through with us, and they always want to make joint visits and learn because they're not getting that. So I've done in-services, I've done webinars, I've done all that publications, but like, how do you get it in the hands of the people who need it? So that's what prompted me to think of an app. So I'm not very techie, but I was able to find a group to put my, thoughts into action on it with an app. So
Uh-huh.
that was it. It was just like, how do I get this tool in the hands of people who need it? There's a shortage of wound specialized clinicians and of palliative specialized clinicians. So I was trying to figure out, how do I get, if you want the wound to heal, here's your options. And even if it's not going to heal, let's say a malignant wound that's bleeding or has odor, what can you do for that? So I put it all in there. So I
Hmm.
think just all my experiences, all these years, I want to get into a tool that somebody else could benefit from.
Yeah. And you recently launched the app, right?
Well, it was actually launched a couple of years ago. At first it was called Palliative Wound Pro. Then was advised by specialists in the field, don't narrow yourself. And then it changed the name to Wound Care Pro. And then it was free for a long time. Then I charged a low fee. And now we're going to switch it to a yearly subscription because it costs to keep it maintained. So
Yeah.
that's been a change recently. And then when clinicians have reached out asking about ostomy care, I end up adding that in there. And as I've come across other skin issues that patients may have, like with the shingles or other things like that that I'm learning and helping patients, I put that in there as well. So somebody has a section of, especially as patients are living longer, we're seeing all these skin issues, whether it's a blistering
Yeah.
disease or
Hmm.
again with shingles or allergic reactions. So when I see that, I have a picture and what do we do for it and show the before and after how it healed to help others.
Yeah, 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 yeah. And you mentioned something a little while ago about, yourself, plus you're still noticing that nurses are coming not really having a good immersion in wounds and wound care and even skin issues. And given how pervasive that can be, because if you're immobile, you're prone to skin issues. If you have allergic reactions, you're prone to skin issues, all kinds of things. Do you think we need to be doing a little bit more from the education side? That seems to me like there's a big gap there.
There's definitely a big gap there. And even when the patients are on hospice or palliative care, they've all these things going on. The wound is like, they seem to focus on, even if the patient's, very end of life because it's so visual. Like, why is this
Yeah.
happening? So we need to know what's happening. How do we try to prevent it? Or if it's skin failure, sometimes it happens just at the end of life, to educate the family. And even I'm the expert witness doing these chart reviews for facilities being sued for pressure
Mhm.
injuries happening. As I go through the charts, there could be thousands of pages. I barely see a wound measurement. You hope that you'd see that
Mm.
they're educating the family and things like that. And I've been on the defense side trying to defend the facility as well. I'm looking at this person's in their 90s with end stage cancer. All these things are going
Mhm.
on, but the family, I don't see that they were educated that this is part of that, unfortunately. They understand the loved ones in heart failure, renal failure, but they don't understand skin failure too.
Mhm.
So,
Mhm.
and the facility is being sued because they think this should never have happened. So I think we need to be educated more to know what we're looking at, how to treat it, and to educate the family if
Yeah.
we see what maybe a Kennedy terminal ulcer towards the end of life and not necessarily neglect.
Yeah, exactly, exactly, exactly. And that puts the family through more trauma than needs to be.
Absolutely. Absolutely. I remember I had this one patient I'd seen, and the daughter was the main caregiver for her father. And they called me in, and she maybe it was unrealistic what she expected, but still, you want to maintain hope. Let's try to heal dad. And then
Mm.
eventually he did pass away. But when she called, she was so happy that the wound did improve somewhat, even though he passed away. She felt guilty that I didn't get there sooner in her mind. So I think if we educate, listen, we're going to do everything we can. Let's remain hopeful. But we do see actually a lot of healing happen against all odds, which is very rewarding on our hospice program.
Yeah, 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 yeah. So, um, one of the things you talk about also is the difference between palliative care and hospice care. Could you clarify that a little bit for us?
Sure. Well, palliative care, if somebody has an advanced illness of any sort, doesn't have to be cancer, it could be neurological, it could be, advanced dementia, the family needs, a little more support to navigate,
Mhm.
whether it's advanced directives for the person or symptom management. They don't necessarily have to have 6 months or less of mortality, the risk of mortality. Whereas hospice is more of the end stages
It's
of
an S.
palliative care. If the person is 6 months or less, if the disease runs its normal course. Sometimes we have patients on for much more than that, and they actually
Yeah.
stabilize and they come off hospice. And if things, deteriorate again, they can come back. But palliative care could be much more upstream, and especially in the hospital, and there's so much going on. I even have a friend, her sister has, tongue cancer, and she's overwhelmed. I said, you got to call palliative care, and they'll help you navigate the system, get adequate pain management, and support the family.
Yeah, yeah, yeah. And I'm glad that you're talking about that particular difference because I notice we tend to use them interchangeably or think that they're pretty much the same, just different words for the same thing. But really, the goals are different.
Absolutely. Yeah. I did home-based palliative care a few years ago, and we see so many patients in the community, and even their physician might not even know about it. Like, they don't need palliative care. They're not. And I said, no, no, I'm not talking about hospice. I'm talking about palliative care. We're going to go in and we have the social worker, spiritual care. It's a whole group effort to help support the
Mhm.
patient and family.
Yeah, because you're looking for good quality, the best quality of life at that point, not,
Absolutely.
yeah, exactly. So here was what was in the news yesterday. I'm going to bring it into our thing. Amazon just laid off like 14,000 people because they said AI can replace their jobs. And I think UPS is laying off like 40,000 or something. What do you see for healthcare in terms of technology and where we're going with this?
I mean, I guess more technology is going to come into it, more AI, and I guess it behooves us to get trained in it, because we're going to need somebody to, provide all
Yeah.
the, search into AI that it's reliable. They're going to need nurses and, people who are educated to be able to provide the right answers. Or if you're typing in, what do I do for this wound or something, they need somebody that knows what they're talking about to help navigate that and have the right information provided. Yeah, so I think things are changing. I think as people are aging more, there probably more long-term care needs and
Yeah.
home care needs and hospital and home care, that kind of thing, getting people out of the hospital.
Yeah, 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 yeah. I was thinking about that. Yes, as we talked, as I listened to this, and I'm thinking we probably need to, and maybe we're a little bit behind, to bring a little more specifically talking about AI into nursing education. And we can't wait until we're going to be always behind the curve if we kind of wait until we get there, to try
Absolutely.
and blow that. Yeah. What advice do you think you give to someone who wants to be a nurse?
I think, when you're a new nurse, it's overwhelming. There's so much to learn, but, give yourself a break, seek mentors, people have gone before you, to what you can learn from them. And constantly, learn this conferences, whether virtually or in person, and lots of free resources out there that somebody could learn. So I think it just, to empower yourself, get certified, be a specialist. And there's so many different avenues of nursing. So if one doesn't work for you, like you said, you didn't like home care, and I love
Mhm.
it, or somebody else may love long-term care, so or
Exactly.
informatics or that kind of stuff. So I think it's just a great field as far as that. It's not so narrow.
Yeah, yeah. And the thing you just mentioned is that there are a lot of free resources out there, and they are so many. Um,
Absolutely.
because very often, people, as especially young nurses, you're coming out of school and you're coming out of school with student loan debt and all of this kind of thing, and you think, I can't afford to take on. There's a lot of free stuff.
Oh, absolutely. Even the Wound Ostomy Incontinence Nursing Society, they give a free full day of wound care education, and then they'll have it on demand for a couple of months. So there's no reason somebody can't avail themselves to something like that.
Yeah.
Absolutely.
Yeah, yeah. I think that's so important, and I'm so happy that there's so much out there that we can access.
Absolutely.
So, self-care. What does it mean to you, and what do you do to care for you?
Yeah, I love just having like no schedule sometimes, because it's like you're constantly pulled in so many directions, constantly checking emails and phone
Mhm.
calls coming in and helping order supplies. It's just like nonstop. So just to have the phone away from you and be out in nature, I think I like to go for a walk near the water. I'm lucky I'm in Long Beach, so the beach is not too far, to go on the boardwalk and just
Yeah.
exercise, have time to read and learn, if I want to attend a conference without being disturbed, interrupted. Even if it's virtually, that's what I
Yeah.
like. Travel, go with family.
Yeah, 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 absolutely. I think that we're talking a lot more about it these days. And I'm glad that we are
Me
because,
too.
as I look back on my own career, it took me a long time to even formulate the idea that I am part of what the caring is, that I need to care for me. My
Yes,
whole focus and my whole education was about giving out all, giving out all, and then some.
absolutely.
Um, and it took a long time for me to get the idea, to understand that, and then to adjust to try and putting myself in the equation that needed care so that I could care.
So important. Yeah, and to realize too, we can't do everything ourselves. So we reach out to colleagues. One nurse mentor of mine used to
Yeah,
say, spread the wealth, so to speak. So whether it's social worker coming in, physical therapy, or other disciplines to help, because we can't be everything all the time. And we need to, if we get burnt out, we're not gonna be able to help anybody else.
I absolutely. Um, and there's so much talk about burnout and people leaving and people just throwing up their hands and like I can't do this anymore these days. And I think it's sad. I
It
really,
is
I really
sad.
do think it's sad that that's happening. But I feel like we will somehow turn the corner and get there. I hope we do, because
I hope
not
so.
for nothing, but as we get older, we're going to need these young nurses.
I know, I'm thinking the same thing. We're gonna need nurses for ourselves. Yeah. Yes, absolutely.
And thank you so very much for this conversation. I've truly enjoyed it. Any last words you'd like to leave us with?
Just, I think trying to be positive and hopefully change will happen, and, we'll get the support we all need out there, and to help each other, I think is important too, to keep,
Yeah,
the next
yeah,
generation
yeah.
going. Yeah.
Yeah, I agree. Change will happen. It has to. There,
Yes.
there comes a point with everything where you get to a point where, okay, this has to change. And so it will happen. Hopefully it happens in good time.
Sooner than later. I was reading an interesting thing earlier today where some NFL players that retired from the NFL became nurses. I'm like, wow, that's pretty cool. Yeah, I just thought that was interesting. Like, and so other groups
Yeah,
coming in and join our
yeah,
ranks. It's great.
yeah. And that happened quite a lot somewhere in the 90s, I think. soon after the AIDS epidemic blew up and things like that. And there were a lot of firefighters, for example, coming into nursing. Yeah.
Absolutely. Firefighters and police officers that retired then became nurses. Yeah. So
Yeah.
I've seen plenty of that too.
Yeah. And thank you again. Thank you so much for taking the time to do this. I truly appreciate it. It's been a valuable conversation. Thank
Thank you
you.
very much for having me.
My absolute pleasure.
Thank you very much.